One.
Good evening. This is Dr. Mumtaz Niazi. My complete name is Dr. Mumtaz Niazi BinQasim, and today we are here to discuss something very, very important about ultrasound, ultrasound imaging, and ultrasound machine regarding basic biophysical principles of ultrasound and ultrasound machine. First of all, I would like to introduce that all successful men have one thing in common. They are very, very clear headed. So, we'll put more emphasis in the first part of the lecture about why ultrasound is so important, rather essential for all doctors, one category, and medical students, the second category. But before that, I would like to dedicate this whole series of lectures and medical knowledge to be provided to you in future to my late father, Mr. Ghulam Qasim Khan Niazi, my mother, my wife, who spared me to dedicate time to prepare lectures for you, and my two sons. Without the cooperation and guidance of my parents, I would have never been in a position to convey this to you. And last but not least, I would also dedicate my lectures to all those people, friends, who gave me unforgettable memories through their company. Before discussing ultrasound, I would like you to recall what is sound. Sound is a form of energy, first of all, and sound is in the form of waves. So, sound waves refers to a certain range of frequency which a normal human ear can hear. All those frequencies which are below that frequency are called infrasound, and all those frequencies which are above the last limit of the human ear are called ultrasound. But here a question arises, why are we spending so much time in discussing ultrasound? After all, why is it so important? Let me tell you, ultrasound is a modality very, very widely being used in medical sciences in the field of diagnosis and therapeutics as well. Ultrasound is economical, ultrasound is easy for the doctors to perform. Ultrasound can be used in emergencies where it takes less time as compared to CT scan, X-ray films, and all other MRI and other investigations. Obviously, it takes a lot less time than lab tests. Another advantage of ultrasound is that it provides live visual approach to the pathological area. Ultrasound is patient friendly. It has no radiations. It is safe. Ultrasound is going to become the basic necessity like a stethoscope in future days. So, as medical students and as doctors, we are supposed to know about ultrasound, about doing ultrasound and making preliminary diagnosis. Obviously, no doctor can handle all the diseases, all the traumas, everything, but ultrasound provides you diagnostic help in ophthalmology, general abdominal ultrasound, gynecological ultrasound, diagnosing the reasons of infertility, and above all, obstetrics. By obstetrical ultrasonography, we are taking care of two lives, life of the mother and life of the baby which is to be born. Now, a few words about how it can help medical students. You know, radiology is taught in final year, fourth year. Pathology is the main subject of fourth year. So, it can help you view your book live. If you can handle ultrasound machine, you can start making diagnosis on it. It will help you to understand those topics much better than you can understand with book alone. Another advantage of ultrasound is that in this era of competition, if you start your clinic with ultrasound and if you start your clinic with stethoscope and BP apparatus alone, it makes hell of the difference in the image building of the public and community which has to be got treated by you. Remember, knowledge is an ocean and we can hardly digest one drop out of it. Don't forget, at this moment we are talking about basics of ultrasound. Basics means being capable to do ultrasonography at your clinic and having very clear idea about a limited range of pathologies or normal conditions which every doctor is supposed to know. But unfortunately, among thousands of medical institutions, it is known to most of the people that some of the institutions don't fulfill the criteria of teaching the complete matter to their students. This lecture plus the lectures to follow will also help you a lot. And I wish these are helpful for you from first year to the final year. And don't get worried, this is basic series. Then, by the grace of God, we'll try to introduce advanced ultrasonography. Then lectures on color Doppler, lectures on interventional therapy. Interventional therapy, while talking about ultrasound, means that ultrasound guided intervention like drainage of the cysts, injecting something under guidance of ultrasound and taking biopsies. Future of ultrasound is, in my opinion, is much more brighter than any other field, because a lot of research and effort is being put internationally in many countries to improve the range of ultrasound. For example, bone and gas are the two enemies of ultrasonologists. Therefore, we cannot, there was a time when we couldn't talk about lungs after doing ultrasounds. But today, a lot of research work has been done in many countries and imaging has been made possible where we can get, because it is safe, it has no radiological waves, it is patient friendly. So, in future, what we expect, ultrasound will have many times more application in diagnosis and therapeutics as well. Here I want to point out to another fact. Since ultrasound has much more, rather a lot to do with visual judgments, So, examples given in the lectures will be related to those examples which we see many times in our everyday life, like birds, like structures which we are very familiar with, like most of the live examples, like the face of Mickey Mouse, which everybody knows. If sometimes we see pathologies or normal structures, we find tissues which are similar to Mickey Mouse face appearance. But I must tell you one thing. Basic knowledge of the three basic subjects in medical field, anatomy, physiology and pathology, are mandatory. That's not in the scope or in the field of neither ultrasound nor this lecture. This is basic lecture in which I hope I have made clear that what you are going to see, listen and being taught in future lectures related to a series of basic ultrasound lectures. These basic lectures are, for one purpose, the theory of ultrasound. These are taught in our institute named BinQasim Institute, and without these you cannot go on proper lines while doing practical experience. But remember, these are theoretical lectures. Base. On base you have to construct the practical experience. Practical experience in our class is provided through audiovisual lectures, PDFs and hands-on practice on the patient. That is the complete picture. One thing may not be sufficient for you to listen, view and then start doing ultrasound. So never forget this thing. Now we come to sound and ultrasound. As I told you earlier in this lecture, sound is a form of energy and it is wave form. What is wave? I explain it. You must be very familiar, everyone is familiar, but this is wave. Wave consists of one complete cycle, this and then this. If we reverse it like this, it will become, rather I change the color, it will become like this. So when we cut it, it goes like this. One complete cycle is wave and the distance of one complete cycle is called wavelength. Wavelength is the indicator of the characteristics of the sound waves or ultrasound waves. Now we select one time unit for that, and that is 1 second. How many waves do we have in this 1 second time frame? It is 1. So the number of waves in a specified time period, which is 1 second, is called frequency. If there is only one wave, it is 1. If it is 10 waves in 1 second, the frequency is 10. And if it is 1 million, the frequency is 1 million. Clear? Dr. Star, clear? Now we move to frequencies beyond ultrasound. Obviously, when we have frame of 1 second, there will be in very high number of frequencies, waves in that 1 second. This clears two situations. One, if we increase the frequency, wavelength decreases, and if wavelength increases, the frequency decreases. Clear? Unit of frequency is hertz.